Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the neurological assessment, in which we'll talk about the reflex testing. So common reflex testing will be biceps reflex, triceps, brachioradialis reflex, patellar and the Achilles reflex. So first is the biceps reflex testing. So triceps nerve roots are C7 and C8, and which is a radial nerve. So this is the most easily done with the client seated. The biceps reflex is elicited by striking the biceps tendon over a slightly flexed elbow. So examiner supports the forearm with one arm while placing the thumb against the tendon and striking the thumb with the reflex hammer. So the normal response is flexion at the elbow and contraction of the biceps. Second is the triceps reflex. So to elicit a triceps reflex, patient should be in elbow flexed and in seated position, and the examiner supports the patient arm and identifies the triceps tendon by palpating 2.5 to 5 cm above the elbow. Direct blow on the elbow normally produce contraction of the triceps muscle and extension of the elbow. Next is brachioradialis reflex. In this, when with the patient's forearm resting on the lap or across the abdomen, the brachioradialis reflex is assessed. Gentle strike the hammer 2.5 to 5 cm or 1 or 2 inches above the wrist, resulting flexion and supination of the forearm. Next is the patellar reflex testing. So which will be test the Achilles, which is the nerve root of S1 and S2, that is sciatic nerve. In this, the patient should be in the high seated, and patellar reflex is elicited by striking the patellar tendon just below the patella. The patient may be in sitting or a like position, and the patient is in supine. The examiner supports the leg to facilitate relaxation of the muscle, and it results in the contraction of the quadriceps. Knee extension are normal responses. Next is the Achilles reflex testing. So to elicit an Achilles reflex, the foot is dorsiflexed at the ankle and the hammer strikes the stretch Achilles tendon, and this reflex normally produce plantar flexion. Next is the Bembisky reflex. So the clients may either sit or lies in spine. Use the handle end of your reflex hammer, which is solid and comes to a point. Start at the lateral aspects of the foot. Apply the gentle steady pressure on the end of the hammer as you move medially, stroking across its area. The well-known pathological reflex indicating of the central nervous system disease affecting the corticospinal tract. Thank you.